have fewer protections if you're a patient at an Arizona hospital. The state health department is temporarily stopping enforcement of certain regulations. The hospital says it's just necessary now because of the pandemic, but others say it is just going too far. Let Joe knows. Joe Ducey has more.
I'm surprised they asked for all of the things that they did.
She's talking about 45 requirements affecting patient care that Arizona hospitals want temporarily halted. Caitlin Donovan is with the National Patient Advocate Foundation in Washington, and she's concerned.
Some of the things that were alarming were what seemed like an almost systematic cutting off of patients from those who would advocate for them and for their caregivers.
The Rebound Arizona obtained this letter from the Arizona Hospital and Healthcare Association and backed by major hospital systems here, sent to the Arizona Department of Health Services. They asked for the nearly 4 dozen current requirements to be waived, saying they impede the ability of hospitals to fully implement their emergency plans during a COVID-19 surge. Some of the waiver requests are understandable, like where patients can be placed in a hospital, but others a little more troublesome, like a patient's right to a telephone.
That raised a lot of eyebrows.
Donovan says with COVID keeping patients isolated from family, their access to a phone is crucial.
That way, not only can they talk to them, but they can also talk to their doctors.
Hospitals are also asking that adults and children be allowed in the same rooms and waiving patient rights not to be discriminated against based on race, national origin, and all of these criteria.
That was incredibly concerning because we always want doctors to be making decisions for medical reasons, not for any innate biases they may not even know that they have.
As COVID-19 surges, there's been concern hospitals may prioritize the use of equipment like ventilators based on age or patient condition. Hospitals seem to be addressing that here, saying they don't want to consider discrimination if circumstances require the use of tools to prioritize the allocation of scarce equipment, personnel, and beds. The discrimination waiver was not approved, but ADHS did just approve 16 of the 45 waiver requests, including the one involving that telephone. In a letter, ADHS Director Kara Chris says they didn't approve all waivers because of some concerns about the potential risk to health and safety. Donovan says these requests and decisions needed to be transparent and have a public buy-in.
What worries me about this type of letter, and even its response, is that it kind of lacked those points. There wasn't a public forum. There wasn't any type of conversation with the public.
And she wonders how long patient care and privacy rights will be suspended.
This is already stretched on a lot longer than we expected at first, and we don't know when it will end.
Donovan advises be prepared just in case by naming a medical decision maker now and coming up with a list of what you might bring to the hospital, like a phone and a charger. We wanted more clarification about why these waivers were requested for you. Banner and Dignity did not get back with us. Mayo said that the Arizona Hospital and Healthcare Association would speak about it, but over 2 days we tried to get comment. They did not get back to us so that we can give you more information. We'll stay on this one, and if you've got a concern for us, email rebound@abc15.com. I'm Joe Ducey. If you've got a problem, let me know.